Diabetes, also known as diabetes, is a heterogeneous metabolic disorder characterized by increased blood sugar levels. The cause is usually due to high levels of insulin and the body is unstable, can be deficient or even excessive. If you have diabetes and control your blood sugar and regularly monitor it well, your blood sugar level will definitely be within a safe range, almost like a normal person. Based on the characteristics and progression of the disease, diabetes is divided into types: type 1 diabetes, type 2 diabetes, secondary diabetes and gestational diabetes. Most of the early symptoms of the disease diabetes is a higher than normal level of glucose in the blood. The warning signs of diabetes can range from very mild to no symptoms at all. Some people do not realize they have severe disease or complications until they find out. 1. Symptoms of type 1 diabetes. The disease progresses very quickly. Symptoms often occur quickly within a few days or weeks. Often there is a typical 4 multiple syndrome. Hunger and fatigue. Your body converts the food you eat into glucose that your cells use for energy. But your cells need insulin to absorb glucose. If your body doesn't make enough or any insulin, or if your cells are resistant to the insulin your body makes, glucose can't get into them and you don't have energy. This can make you hungrier and more tired than usual. Urinating more often and being thirstier. The average person usually urinates 4 to 7 times in 24 hours. But people with diabetes who have high blood sugar may go much more than usual. Why? Normally, your body reabsorbs glucose as it passes through your kidneys. But when diabetes pushes your blood sugar up, your kidneys may not be able to take it all back. This causes your body to make more urine and lose water. The result? You'll have to go more often. You may also go more. Because you're urinating so much, you may be very thirsty. When you drink more, you'll also urinate more. Dry mouth, increased thirst, and itchy skin, because your body is using fluids to pee. There is less moisture available for other things. You may become dehydrated, and your mouth may feel dry. Dry skin can make you itchy. Significant weight loss. Although the patient eats a lot, he loses a lot of weight. Decreased vision. Changes in fluid levels in your body can cause the lenses in your eyes to swell, leading to blurred vision and decreased vision. 2 symptoms of type 2 diabetes. Live type 2 diabetes. Diabetes develops very quietly or even without any symptoms. Without the loud symptoms like type 1 diabetes. You may be diagnosed with diabetes because you go to the doctor for another disease and accidentally test your blood glucose. Or you may discover the disease because of other complications such as an infected wound that is difficult to heal. In general, the patient may never feel the obvious warning signs. Diabetes can develop over many years and the warning signs can be very difficult to diagnose. Some signs include yeast infections. Both men and women with diabetes can get these. Yeast feeds on glucose, so having plenty around makes it thrive. Infections can develop in any warm, moist folds of skin, including between the fingers and toes, under the breasts, in or around the genitals. Slow healing sores or cuts, over time. High blood sugar can affect your blood flow and cause nerve damage that makes it difficult for your body to heal wounds. Pain or numbness in your feet or legs. This is another result of nerve damage. 3. Symptoms of gestational diabetes. High blood sugar during pregnancy usually has no symptoms. You may feel a little thirstier than usual or have to urinate more often. It is usually detected during the triple glucose challenge test at 28 weeks of pregnancy. Diabetes can occur in anyone and for both type 1 and type 2 diabetes. You may experience one or more warning signs related to diabetes. If you suspect, go to medical facilities, hospitals to be diagnosed and treated by a doctor. If you suspect you may have diabetes, you should see a doctor immediately. During the examination, your doctor will ask you about the symptoms you are experiencing, whether anyone in your family has diabetes, the medications you take, and any allergies you have. Based on the information you provide, your doctor will decide to do some tests for you. There are several tests to diagnose diabetes. HbA1c. This test shows your average blood sugar level over the past 2 or 3 months. This test does not require you to fast or drink anything. Fasting plasma glucose, FPG. You will need to fast for at least 8 hours before this test. Oral glucose tolerance, OGTT. This test takes 2 to 3 hours. Your blood sugar level is checked initially and then repeatedly at 2-hour intervals after drinking a specific sweet beverage. Random plasma glucose test. You can have this test at any time and does not require fasting. To better understand your condition and how to treat it, you should also ask your doctor questions about your warning signs or the condition itself. 1. Treatment of diabetes. Diabetes can be treated in a number of ways. Dietary changes, physical activity, and regular monitoring of your condition are important if you have diabetes, regardless of the type of diabetes you have. If you have type 1 diabetes, you will need to take insulin for the rest of your life, because your body does not produce insulin on its own. If you have type 2 diabetes, you can control your condition with lifestyle changes, such as diet and exercise. You may also need to take oral or injectable medications, including insulin or metformin, to control blood sugar. When you have diabetes, you will need to carefully monitor your diet to prevent your blood sugar from getting too high. This usually means watching your carbohydrate intake and limiting processed, low-fiber foods. Your doctor will give you a treatment plan to help you control your blood sugar. It is very important that if you suspect you have symptoms of diabetes, do not hesitate to see your doctor. Early treatment is more effective in controlling the disease, which is the key to controlling symptoms and preventing more serious health problems. If you have type 1 diabetes, you will need to control your glucose levels by combining insulin with diet and activity. If you have type 2 diabetes, you may be able to control your blood glucose levels with diet and activity alone, or with medication as needed. Diabetes is a progressive disease that may require reassessment and changes to treatment plans over time. 2 ways to prevent diabetes. Diabetes cannot be prevented in all cases. Type 1 diabetes cannot be prevented. You can reduce your chances of developing type 2 diabetes by adjusting your diet and staying active. However, genetics and other risk factors can increase your risk despite your best efforts. Even if you are diagnosed with diabetes, you can live a full life. Diabetes requires careful planning and management, but it should not stop you from participating in and enjoying everyday activities.